And now we'd like to return to our speaker for our traditional City Club question and answer period. We welcome questions from everybody, including guests. And holding the microphones today are Operations Assistant Mika Tadashi and Director of Development Jessica Leary-Allen. And now for our first question, please.
Sister Keehan, you spoke very eloquently about the unavailability of health care for uninsured people, the problems they have, 40 million people, and also the other problems that are involved in our health care delivery system. We have a very important election coming up this year. And certainly the role of the president is a very important role in determining what legislation will be passed. As you evaluate the three major candidates who remain for the presidency, which one of the three do you think is least likely to press for these reforms, and which one of the three do you think is most likely to press for these reforms?
I represent a 501c3 agency. So I need to be inordinately careful as I answer that. I actually think that when you look at the three candidates, the one who's got the most experience, whether you like her plan or not, is Hillary Clinton. I mean, she's put the most time into that particular issue. I honestly don't think we're in a presidential campaign. You get much of the meat of a health plan. Everybody has a health plan because, quite frankly, in a campaign, anything you say will be used against you. So I do believe that there are pieces of one that I like more than another, but quite honestly, I don't think we have a clear picture of exactly what any of the three of them would do once they got that magic number and got elected. We hear, and we'll bring all the brightest minds together, we'll do this, we'll do that. But specifics, there's certainly a difference in the approach that Senator McCain seems to be advocating that is significantly different from one that Senator Obama or Senator Clinton is advocating. I think that what they think is very important, but even more important is a bulletproof Congress. If we don't have enough senators and enough representatives that really want health care, and not tinkering around the edges, but a solid health care reform, we won't get it no matter what the president wants. So we saw that with the first President Clinton.
Yes, good afternoon. I have basically two questions. One is the first goes along with perceptions. And the quote-unquote socialized medicine is one thing that's always going to work against ever having such a system become effective. Systems, let's say the German system, the Dutch system, are not, they're quote-unquote socialized. They do have private insurance companies. They're very similar in the function of, let's say in the state of Ohio, that everybody is required to have auto insurance. And as in Germany, you are all required to buy in to an insurance company, whether that be from your taxes or be from your, or actually buying supplemental insurance. So that's the one thing in perception. How can you, the first question is once again, how can you change perception away from socialized medicine? And the second thing is that we think of people who are uninsured as the poor. But most people don't realize that a lot of the uninsured in the United States are young professionals, such as part-time teachers and substitute teachers.
That's absolutely true. Let's start with the last one and work up. You're absolutely right. The old phenomenon of thinking that the uninsured or the unemployed or the lazy is long gone. Many people some are young professionals who we accuse of thinking they'll live forever, but quite frankly, many of the uninsured are employed people who simply can no longer afford the employee portion of it because of supporting 3 children. And so they give it up, or they take this plan that only covers after a huge deductible. So it is not just the poor who are hurting from this. How we change that socialized medicine, I think we have to do it by showing the impact, because people talk about, well, I don't like mandates. And that's culturally something that, we say we don't like, and yet we impose lots of them, from don't smoking to, have auto insurance. So even though we say we don't like mandates and we don't like socialized medicine, I think the most important thing that has moved this agenda along a bit has been that the American business community recognizes what's happened, and more American people are recognizing what is happening. I mean, it is very clear today that you are paying as the individual or as the business for all of the uninsured, or not, well, I shouldn't say all. You are paying for a huge percent of the uninsured, and you are paying for a huge percent of the government programs for the poor that underpay for the cost of care. When you realize that, you say, well, wait a minute. Would I allow people on the road to mandate that I buy auto insurance, but they don't buy auto insurance, and so we get into an accident, it's always me that's going to pay? I think the more you understand the truth about how this health system is working, I gave a talk not too long ago to a state association of children's hospitals. Now, children's hospitals take care of the sickest children, and children that not only are the sickest, but tend to be the most expensive. And one of the CEOs of one of those hospitals, which will remain unnamed, said to me, we were talking about this problem, he said, we had an audit firm evaluate our finance structure, and it became clear to us that we were putting almost $3,000 on every bill above what it really costs for that person's care, because of all this cost shifting of the uninsured and the underinsured. So you as a parent putting your child there, it's expensive enough to pay for your own child, but you're paying for a lot of other people. And I think when people realize that, we may get a little less resistance to the socialized medicine. And also, I mean, what is the one healthcare program that if you oppose it or threaten to undermine it will get you unelected very quickly? Medicare. Yes.
Sister, a wonderful talk. One of your pillars is transparency and consensus. And healthcare executives in the current system are faced with a lot of difficult decisions. On the one hand, Americans demand the best in healthcare, the newest PET scans, CT angios, what have you. Say hypothetically $2 million. On the other hand, we know that $2 million could be potentially better spent on 3 more health clinics or community access. Where does the consensus begin?
Well, I think that's part of getting a much more educated public, and as many people are saying, an independent, evidence-based research center for this country that would look at, so that not every new pill that comes out, we've just been faced with 3 or 4 new drugs that sold out the gazoo. We were treated to ads for them every 15 minutes that only a year and a half later we find out not only aren't better, they aren't as good, but they're far more expensive. We've got some places that are doing some really wonderful studies on things like back pain, and that you don't need to start with a PET scan or an MRI. This is where you need to start, and these are the indications. And so I think it is going to have to be driving to more of transparency on what works and what doesn't work. And that we don't need to do everything we can do for you. We need to do everything that will be good for you, and at the stage it will be good for you. And if people have an understanding that this is a care plan that's been vetted by people who are independent, who don't own the MRI, or who don't own stock in the drug company and are truly independent, and this is a consensus from really top-notch people from great centers throughout our country, that this is the way to go. And we're not denying you this MRI, but this is the way we should go. I think that we will get a better feel. But right now, the incentives for the providers are more and more and more. And so part of changing the delivery plan is going to be changing the incentives and aligning the incentives to health as opposed to disease.